Hey guys, welcome back to another video. In today's video, we are going to talk about some of the reasons why yeast infection or vaginal infection will always come back. So if you have not subscribed to this channel, kindly do so, like the video, share and comment. Let's get into the video. These are some of the reasons why vaginal infection will always come back. Number one, your personal hygiene might be very poor. As a lady, your personal hygiene should be very nice, very good, very perfect, so that you don't keep on getting vaginal infection. You should take shower twice a day or maybe once if you have to. And also you should put on panties which are cotton, and you should also wash those panties very clean, and you put them on the sun so that the infection can be burned by the sun. Second one, you might be pregnant and you don't know. You know, if you are pregnant, usually women who are pregnant, sometimes they usually, when you are pregnant, you usually get low immunity. Pregnancy usually lower immunity, and therefore your body sometimes fails to fight infection. So you might be pregnant and you don't know, and therefore you can keep on getting vaginal infection. The third point, you might be having diabetes mellitus, DM, and you don't know. If you are a woman, it is always advisable that you go for checkup you go and do the checkup of diabetes mellitus and see if your blood sugar is high, because if you have diabetes usually lower immunity, and therefore your body cannot fight infection, and therefore sometimes you can get recurrent of vaginal infection, or the vaginal infection might keep on coming back most of the time. So if you suspect that you are having too many vaginal infection, you're supposed to go and check if you are having diabetes mellitus. The next point, sometimes ladies, we like using scented soap. We think that not even scented soap, scented perfume down there on your vagina. Ladies, sometimes they use scented perfume, scented soaps on the vagina. And vagina is meant to smell like a vagina. It should not smell nice. So if you're using scented soap, scented perfume on your vagina, you are increasing your risk of getting vaginal infection. So if you're using those things, you might be getting vaginal infection and you don't know. So if in case you're using those scented things, stop them, and just know that vagina should smell like vagina. It should not be smelling nice or something else. It should smell like vagina. Yeah. And that is a warning to you. You should not use scented equipment, scented soap, scented perfume on your vagina. Number 5, maybe you are using family planning and you don't know that family planning usually cause hormonal imbalance, and when you have hormonal imbalance, they usually favor growth of bacterial infection on the vagina. So you will get that if you are using hormonal family planning, you might have recurrent vaginal infection. So you should stop using hormonal family planning and learn how to use natural family planning, because you will not have any problem with so many hormonal hormonal what? Hormonal conditions or hormonal condition that can be caused by hormonal imbalance. The next point, your DNA might be working against you. What is DNA? DNA is deoxyribonucleic acid. It is a polymer and its function is to carry out genetic function to help in its function is to carry out genetic instruction for development, for functioning of the body, growth and reproductive. That is its function. So sometimes it is working against you, and therefore you will get recurrent vaginal infection. The next point is your immune system might be poor because of maybe chronic illness such as HIV. Maybe you are having cancer and you are using some drugs that are lower immunity, or the disease itself is lowering immunity and your body cannot fight this infection. So if you are having those in chronic illness, you might be having a recurrent vaginal infection, and I'll just advise you to keep in touch with your doctor so that you get help. Number 9, and the second last, is that you might be approaching menopause and you don't know. It's not a must that when you are 40 plus years is when you can approach menopause. Some people start approaching menopause even too early. So when you are approaching menopause, there is hormonal imbalance, and when you have hormonal imbalance, there is a favorable condition for bacterial growth, and you will get recurrent vaginal infection. Candida albicans will always keep on coming up. So if you're approaching menopause and you don't know, maybe you can go and confirm. You might be having recurrent vaginal infection. So just don't worry, just treat them according to the instruction of the doctor, or consult with your doctor so that you can be told what you are supposed to do. Number 10, you might be using some antibiotics that kills harmless bacteria in our body, and these harmless bacteria, sometimes they protect us. And if this bacteria has been eliminated when you are using some medication that kill all of these bacteria, especially normal flora, you will keep on having vaginal infection. I think I've reached the end of this video. I'll only advise you or request you to subscribe, like the video, share, comment. Tell me what you want me to talk about in the next video on the comment section. Bye. Let's meet in my next video.